Good morning, and welcome to this edition of Medical Minutes. I'm Dr. Peter Russotto, your host and moderator. Today's topic is lymphedema. I would like to welcome Lori Thomas, who is here with me in the booth, to discuss her new clinic at Passavant Hospital. Lori is an occupational therapist and lymphedema therapist recently hired by the hospital. Many of you listeners are probably thinking, what is lymphedema? So I will start off with a question and ask the expert. Lori, what is lymphedema?
Lymphedema is an increase in edema, or what many of us call swelling, in a body part. Most commonly in an arm or a leg, but it can actually occur anywhere in the body, even in your face. Lymphedema is a little different than other types of edema. As you know, most people can swell for lots of reasons. However, with lymphedema, it's related specifically to your lymphatic system, and it generally comes on rather slowly and progresses gradually. It's not the kind of swelling that you're going to be fine one day, go to bed, wake up, and have a lot of swelling. That's not going to be related to lymphedema. A lot of people tell me that they kind of notice it sort of gradually getting worse over time. Maybe their clothes are fitting a little tighter. Maybe their limb feels a little heavier. And then over time it gets worse. The limb can get larger. You can have skin changes and even wounds.
So usually without any type of treatment, it will progress, though.
Yes, it will. Without treatment, it definitely will progress.
And you said it's mainly in the upper extremity, is that correct?
It can actually be anywhere in the body. The number one cause of lymphedema in the United States is related to breast cancer, and that's because of the removal of the lymph nodes in your armpit. And when that happens, and the lymphatic system isn't able to get rid of the extra fluid like it normally would, and so you can have an increase in your arm size, but also can happen a lot in the legs. I see a lot of people with lymphedema of their lower extremities, and this is usually because of situations like chronic venous insufficiency, where the veins aren't moving the fluid back up like normal, and the lymphatic system then comes in and helps that out. And then over time, if it's not addressed appropriately, then the lymphatic system sort of wears out, for a lack of a better expression. And then you also have a lymphatic issue on top of your venous issue. And you can notice this with venous insufficiency. You put your feet up at night and everything kind of gets better. And then when the lymphatic system starts to become involved in that, it's when all of a sudden you go to bed, you get up in the morning, and it's just, the swelling just didn't go back down quite as far as it used to. And then over time, it's just sort of always there.
You touched a little bit about some of the causes of lymphedema, but in my medical training, we were talking about primary and secondary causes. Can you expand on that for the listening audience?
Sure. Primary lymphedema is usually genetic. It is fairly rare, but it is present, and it's when, for whatever reason, a lot of times we really don't know, but the body has not formed the lymphatic system quite right, and in that case, we have what we call primary lymphedema. Sometimes that shows up mostly when people hit maybe puberty, or after women have had their first child. And that's sometimes when it shows up, if not when they're children. Secondary lymphedema, though, is the most common, and it is related to a cause such as a trauma, a surgery, major infections, something that's then damaged that lymphatic system.
Would obesity be a cause? Because sometimes when a man or a woman has a large girth in their belly called a pannus, that could be an obstruction to the venous flow and the lymphatic flow.
Absolutely. Obesity is definitely a cause for secondary lymphedema, and we're seeing more and more of that.
Even you might say gravity is a cause. Sometimes people who are on their feet all day long, like you said, the venous system suffers, well, so will the lymphatic from being in the upright position.
Exactly. The venous system moves about 90% of the fluid in our bodies, and the lymphatic system is that other system that picks up about 10%. But when the venous system isn't working quite as well, like when you said, when you stand all day on your feet, especially if we've gained a little weight over time, some age, maybe you've had some injuries, things like that, then that lymphatic system definitely starts to get injured in the process.
Now we talked about, the definition of lymphedema and the causes. What are some of the treatments available to people afflicted with this pathology?
Sure. Unfortunately, there's no cure for lymphedema at this time. However, there is hope because there is a treatment, and the treatment for lymphedema is called complete decongestive therapy, or CDT. And CDT was actually implemented originally in Europe, primarily in Germany, and it has made its way over here to the United States. And it's a very non-invasive type of treatment for lymphedema. It includes manual lymph drainage, or MLD, compression bandaging, exercise, skincare, and of course we train people on how to take care of themselves for the long term. Usually it's performed by a certified lymphedema therapist, and that means you've gone and had extra training in lymphedema specifically and in how to treat lymphedema. Usually it's a physical therapist or an occupational therapist who has already had their degree in therapy that's gone on for this extra specialty. And like I said, I'm an occupational therapist, and so I have had my CLT now for about 8 years, and that's taught me how to do complete decongestive therapy. When we're talking about like manual lymph drainage, that is a very special massage, and it's very light, and what we do is we reroute the lymphatic system from the part that's not working to the body parts that are, so that the body can get rid of it. And then we wrap people up with compression bandages. They're short stretch bandages. They kind of look like an ACE wrap, but they're completely opposite from the ACE wrap in how they work. And then that helps give the body like a containment so that it can't keep swelling, and we can help the body remove that further edema. And then we also do exercise to help the muscles get involved and those types of things. And the whole goal is to remove the extra fluid so that, number one, the person can feel better, and then number two, that we kind of decrease the risks of infections and further problems that edema can cause.
And it must be a big part of your process to educate the patient so they understand, like you said, it is a treatment, constantly ongoing. There is no cure.
That's exactly right. And the education part is so important because it's like everything else. I always tell people, I can help you get rid of the fluid, but if you don't keep it up, it'll come right back. Because the problem is that system has been broken. And although we can help the fluid go away and we can help the limb feel fairly normal again, we can't fix the broken system. So my job then is to help people learn how to take care of this themselves. And that may include compression garments, which unfortunately people would have to wear for the rest of their lives.
Those compression garments, I believe, are custom fitted usually, correct?
Yes. A lot of people have had bad experiences with some of the compression garments maybe you've bought just off the shelf somewhere. The kind of compression garments we use are very special type of fabrics, and they're custom fitted to make sure that not only do they work really well, but that they're comfortable for you. The other thing is it's my job to make sure you can get them on and off. So I take that very seriously because a lot of people have had problems with that. So we make sure that you get what you need and that you can get them off and on because you'll need to wear them for the rest of your life.
The treatment for the compression therapy and your manipulation therapy, so to speak, is that painful for the individual?
Absolutely not. It should never be painful. It's very, very non-invasive, like I said, and it's very light. There is a little bit of inconvenience because you have to wear the compression for it to work properly, but with time that gets better, and the majority of my clients have told me that they actually feel better with it on than with it out. Some
of the barriers to treatment for individuals is, of course, the social stigma. I've treated many a patient that have extremely large limbs because of lymphedema, and they always feel like, well, nothing's available for me to help. But you're here to say that there is always hope, as you say.
Absolutely, absolutely. For the longest time, people, they didn't feel like they could get help, but also there wasn't a lot of help available because there's not a lot of us who treat lymphedema. But what I have discovered is no matter how long you've had it, we can help you.
Yeah, maybe never totally get the limb reduced to the normal size, but significantly decreased from what it was.
Absolutely. If it's been 30, 40 years, it'll be very difficult to get it back to the normal size, as you say, but we can definitely make it much, much better.
Does most insurances pay for this and Medicare pay for these services?
Yes. The majority of the insurances and Medicare and Medicaid all pay for our services. The only thing that Medicare does not pay for is they do not pay for the custom compression garments. But this is something that there's a lot of opportunities out there to find other sources of payment.
There's a lot of myths about it, and maybe you can answer this question. In the lay population, they believe if you've had lymphedema to never travel in a airplane. Have you ever had that question posed to you?
Yeah, absolutely. A lot of times there is the idea that if you've had lymphedema or if you're at risk for lymphedema, so if you've had lymph nodes removed, you do need to be cautious about air travel. It doesn't mean that you should never travel on an airplane, but you need to be cautious. So in that case, I would talk to your physician as well as your lymphedema therapist, and we can provide you with maybe a sleeve or a garment that you can wear while you're on the plane, even teach you even how to do wraps while you're on the plane, and that will definitely reduce your risk, and that's the best thing you can do for that. Definitely keep traveling, just be aware.
I know a lot of women, like you said, with the breast cancer, when they've had axillary dissection, which is dissection in the armpit for the lymph nodes. Some women have been, 10, 15 years post-mastectomy, and they said, well, I've been out for 10 years. I haven't had any lymphedema. I can't get it. That's absolutely not true. That,
unfortunately, is not true. The way we classify lymphedema now is we do it in stages. So if you have had any lymph nodes removed or treatment for breast cancer, they consider that as stage 0. That means that you do not have lymphedema, but you are at risk for lymphedema. And then if the swelling progresses or if it starts, then it goes through different stages, stage 1, 2, and 3. But definitely need to be aware of that. It can happen, unfortunately, anytime. I've had some women who have done really well, and it was 25 years later that they started noticing.
Yeah, that's what I want the general population to understand. So if they see it starting to, or like you said, even feel it, the weight of the extremity, don't get this false sense of security. It can't be happening to me because I'm 20 years post-surgery. It can happen, unfortunately. If it does happen and everything, where would someone go to get treatment like at Passavant? How do they contact you? What's the process?
Sure. I think you made a very good point. The first thing is to don't ignore it. Never ignore your swelling. Even if you'll probably feel it or notice it before anyone else. To get to us, you need to see your physician first and talk to your physician about what your concerns are, those types of things. Then they can give you a referral for occupational therapy to evaluate and treat. And in that point, you can contact us at Passavant Area Hospital in Jacksonville. I'm there 2 days a week on Tuesdays and Fridays, but you can call anytime and talk to the secretaries and just call the rehab services. And that number is 217-245-9541. extension 3397, and once again that's just Passavant Rehab, and then they can schedule you to see me or Carly Hager. Carly is another lymphedema therapist who's working with us now at the clinic, and we're pretty excited to have 2 of us there now.
I know the response has been very good. You guys are already started off very busy, correct?
We have, and I've just been really delighted. Like I said, I've been doing lymphedema for 8 years now, and I'm really excited to be in the Jacksonville area and show people what we can do to help them out.
Is there anything else you'd like to add to tell the listening audience?
No, I just hope that if you have any type of swelling or lymphedema issues, get a hold of your doctor and let us see if we can help you. If nothing else, we can always give you a few tips and advice on how you can proceed. And we're just really happy to be here to help you guys.
Well,